Hello, everyone. Welcome to Coffee with ClearScript, a podcast series where we break down the big ideas in pharmacy benefit management. Today, we're going behind the counter to focus on mental health, specifically how PBMs are evolving to support better access, affordability, and outcomes in this critical area. I'm Lynn Branch, Client Commitments Director at ClearScript, and joining me today is Nicole Christian, ClearScript's Vice President of Clinical Services. Thanks for being here, Nicole.
Thanks for having me, Lynn. Mental health is a space where PBMs can make a real impact, so I'm glad that we're talking about it.
Yeah, we are just coming off of Mental Health Awareness Month in May, so it's great timing. Let's start with how PBMs are helping plan sponsors navigate mental health benefits. According to the 2022 National Survey on Drug Use and Health, over 23% of US adults experienced a mental health condition in 2022, and that number continues to rise. That's a lot of people, and some are using their pharmacy benefits for therapies. What are some of the key levers PBMs are using today to help plan sponsors manage utilization?
Yeah, we are seeing a shift towards more proactive benefit setup designs, expanding formularies, integrated behavioral health support systems, and smarter utilization management set up on the pharmacy benefit. So PBMs are helping to ensure that members are getting the support that they need. They can access it more quickly and affordably.
Right, formulary management is, it's always a balancing act for sure. How
Mhm.
are PBMs approaching mental health medications specifically?
Yeah, mental health treatment plans are highly individualized. In regards to the medication part of that plan, we prioritize the clinical efficacy and safety, and then we layer in that cost of effectiveness. So always kind of putting what the treatment plan and whether or not those medications are right patient, right time first before the cost. But for example, more than 1 in 10 US adults took prescription medications for depression in 2023, with more women being twice as likely than men to do so. The kind of utilization requires a real thoughtful approach when it comes to incorporating both clinical guidance as well as best practices when it comes to those formulary designs.
Yes, the right patient and at the right cost at the right time is
Mhm.
critical. And one of the tools PBMs use is utilization management, including prior authorization and step therapy. But those types of strategies can be controversial. How do you respond to concerns that these tools create barriers in mental health care?
Yeah, for sure. It's a fair concern. It's hot in the media often. You can see a lot of concerns on social media, on different social media platform, on their message boards and whatnot. But when it's done right, these tools ensure that the appropriate use without delaying care. We're refining criteria, streamlining those approvals, oftentimes making them automatic within the pharmacy system, not causing the doctors to need to call in or do needless paperwork. But we're also incorporating those clinical guidelines that I spoke of and those best practices that physicians are approving and that they're utilizing out in the provider setting that support that flexibility. It's about managing the risk while respecting that clinical nuance.
Right, right. And the prevalence of mental health concerns and people using important mental health medications really does come at a cost, though, right? So mental health meds can be a significant cost driver. What are other strategies PBMs are using to manage spend, considering they without compromising care?
Yeah, that is true. We've had mental health medications around for a while, but with every area of medications and every area of science, we have advancements from year to year. There are new medications popping up every year, and when those medications are new and brand name, those are of higher cost. So those you'll continually see a new commercial online as you're checking out your podcasts. But what we do at ClearScript is we're leveraging different tiers on your formulary. We'll offer plans, different copay optimization, and manufacturing contracting to kind of help mitigate those costs. We're also focused on the member-facing tools, so real-time benefit checks and affordability programs. Those real-time benefit checks help the providers see what is on the formulary and what utilization management might be in place in order to get to the drug that the member can walk right into the pharmacy and get that day. With mental health conditions costing the global economy over 1 trillion in lost productivity annually, affordability isn't just a financial issue, it's also a workforce issue, and keeping members and patients going through their day-to-day and at their jobs and just functioning in their lives.
Absolutely, it certainly is a broad issue. Patients are seeking help in many different places, whether it's through a doctor or a therapist or through support groups. But the community pharmacist is often the first line of contact. So, how are PBMs supporting their role in mental health?
Yeah, as a past behind-the-counter pharmacist myself, we're enabling pharmacists with adherence alerts, those real-time benefit tools, kind of helping direct, even pharmacists can get those messages, knowing where or what medications are covered by a member's health plan, and providing training to identify red flags for members. They're not just dispensing anymore, they're engaging with their patients. They're oftentimes in those rural areas and underserved populations, pharmacists are the most accessible member of a patient's healthcare team. We used to say at the pharmacy, you would see your pharmacist probably 12 times a year, whereas you might only see your doctor once or twice, depending on how often you go in.
Yes, they certainly are the first line of sight for many people who are getting medication therapies. But let's turn to outcomes. Let's talk about outcomes. How are PBMs helping in improve adherence in mental health?
For sure. We're using predictive analytics that flag those non-adherent risks, offering 90-day refills so people have more of their medication on hand, needing to remember to go and pick them up less often. And now in this day and age, integrating refill reminders into mobile apps. With nearly 88% of people with depression reporting a difficulty in daily functioning, adherence isn't just about the medication, it's about the quality of life. So remembering to take those medications and having those helpful reminders through apps are very, very helpful.
Yeah, absolutely. So we've talked a lot about medications, but we're also hearing about digital therapeutics. You tell us about digital therapeutics, what's out there, whether plan sponsors are starting to integrate these tools into their mental health strategies.
Absolutely. So digital therapeutics, they're like app-based CBT programs, cognitive behavioral therapy, guided meditation platforms, and AI behavioral interventions. They're all emerging as a complement to traditional care. Although most of the time these technologies are covered on the medical side with a prescription through your provider, PBMs are beginning to evaluate and include these FDA authorized DTX solutions on formularies as a part of their broader behavioral health programs. So populations with members who are facing barriers to inpatient therapy, whether they live in remote areas, rural areas where getting into a therapist might not be as easy, or access to care, or even in the younger population with strong digital engagement, they might be more interested in those online app experiences as well. Exploring options for digital therapeutics for those members could be an option for plans. The key is ensuring that these tools are evidence-based, secure, and integrated into the broader healthcare ecosystem. So having those be FDA approved and be by prescription through the physician, there's a feedback loop that goes back and delivers information back to the provider about a member's progress through those programs. So ClearScript can work with our clients that are interested in these types of solutions for their benefit plans and help integrate them into our offering as well.
Excellent. Yes. Very interesting emerging technologies there. So another concern is polypharmacy, or when members use multiple pharmacies to fill prescriptions. It's always a concern, especially in mental health, where their members there's a potential for abuse. How are PBMs addressing this?
So with any sort of polypharmacy or members using multiple pharmacies. We're using claims data to identify members at higher risk or higher risk combinations of medications to alert either the prescribers or at the pharmacy level. Our clinical teams can also conduct medication reviews for more complex cases with those higher numbers of medications being used by one member. It's about reducing those adverse events, those therapeutic duplications, and making sure that their treatment really aligns with their what their providers are intending, especially for those members with comorbid conditions or having more than one condition going on, making sure there aren't those interactions or that duplication of therapy.
Absolutely, definitely a concern.
Mhm.
There's a lot of misinformation about mental health and mental health therapies. So I thought we could wrap up by doing a quick lightning round, like myth versus fact. So
For
there are,
sure.
there are common member misconceptions that HR teams and brokers hear all the time. So let's just start. I'll give you some a myth, and you can kind of tell me what the facts are. Give me your point of view on that topic. So let's start with a myth: psychiatric medications are addictive.
All right, Lynn, here's the facts. So most are not. Antidepressants and antipsychotics don't have addictive properties. Some anti-anxiety medications do require some monitoring, but addiction is extremely rare if they're used appropriately.
All right, next myth: if one medication doesn't work, nothing will.
That's a hard one, but here's the facts. Mental health treatment is highly individualized. There are multiple choices. And like I said, there are new ones coming out all the time. Finding the right one is often a process, but there's definitely so many options out there that it's just a, a waiting game, a time game, and you just keep trying.
Okay, how about you can stop taking meds once you feel better?
Yeah, here's the facts with that one. This can definitely be risky. Stopping abruptly can lead to relapse. You always want to taper under clinical supervision.
Uh-huh. What about mental health meds are too expensive and not covered?
Yeah, here's the facts with that one. Most plans cover them. In fact, most are required by state laws, depending on the state that you're in. And PBMs work really hard to negotiate appropriate prices for them and offer savings programs. There are more options than people realize.
So thank you for letting us know some of the facts about mental health medications and therapies. It's been a great conversation. Any final thoughts for our audience of benefit leaders and consultants and all of the rest of our audience?
Yeah, I think as people are beginning to realize that the stigma with mental health is beginning to melt away with more and more public conversations out in the media and in commonplace, that mental health is no longer a fringe benefit. It's becoming central to our workforce and our well-being. PBM are evolving to meet this challenge as well, and we're here to partner with plan sponsors to deliver a smarter and more compassionate care.
Well, we'll leave it there. Thanks again, Nicole, for your great information, and thank you to our listeners today. We hope you found this episode insightful. If you'd like to learn more about how ClearScript can support your benefit plan and navigating mental health coverage and your pharmacy benefit, please reach out to Nicole or visit clearscript.org to reach out to our sales team. So until next time, stay informed and take care. Have a wonderful day.